Hey there, what's up? We're glad you're here. Today, we're tackling a big topic, carcinoma. It's a word that might sound intimidating, but don't worry. Now, don't let the word scare you. We're here to make it simple and easy to understand. We're gonna break it down together nice and easy. So, let's dive in. Carcinoma is a type of cancer. It's one of the most common types. It starts in your epithelial cells. These are the cells that cover the inside and outside surfaces of your body. These cells are like the lining of your organs. They play a crucial role in protecting and covering your body. Think of your skin, the lining of your stomach, or the inside of your lungs. These are all made up of epithelial cells. Carcinoma happens when these cells start growing out of control. It's like a malfunction in the system. It's like a weed in a garden, taking over and causing problems. If left unchecked, it can spread and become more serious. But here's the good news. With early detection and treatment, we can fight carcinoma and win. There are many effective treatments available. So stay tuned as we learn more about the different types of carcinoma, the warning signs, and what you can do to stay healthy. Knowledge is power, and together we can make a difference. Now that we know what carcinoma is, let's talk about the different types. Carcinoma is a broad term, and it encompasses several different forms of cancer that can affect various parts of the body. You see, carcinoma can develop in different parts of the body, each with its own set of symptoms and risk factors. One common type is skin cancer. This type of carcinoma is often caused by prolonged exposure to the sun's ultraviolet rays. Our skin is exposed to the sun's harmful rays, which can sometimes cause these cells to become cancerous. Using sunscreen and protective clothing can help reduce this risk. Another type is lung cancer. This type of carcinoma primarily affects the lungs and is often linked to smoking and air pollution. Smoking is a major risk factor for this type of carcinoma, damaging the delicate lining of your lungs. Quitting smoking can significantly lower your risk. We also have colon cancer, which affects the large intestine. A diet high in fiber and regular exercise can help prevent this type of cancer. And breast cancer, which affects the breast tissue. Regular screenings and a healthy lifestyle are key in early detection and prevention. Each type has its own unique characteristics and risk factors. Understanding these can help in early detection and treatment. But remember, knowledge is power. Staying informed about the different types of carcinoma can empower you to make healthier choices. By understanding the different types of carcinoma, we can take proactive steps to protect our health and support those around us in doing the same. Early detection is key when it comes to carcinoma. That's why it's so important to listen to your body and be aware of any unusual changes. Symptoms can vary depending on the type and location of the carcinoma, but some common signs include unexplained weight loss, persistent fatigue, and unusual bleeding or discharge. Changes in your skin, like a new mole or a sore that doesn't heal, should also be checked by a doctor. And if you experience persistent coughs, difficulty breathing, or chest pain, don't ignore them. Remember, these symptoms don't always mean cancer, but it's always best to err on the side of caution and get checked out by a medical professional. Diagnosis and treatment: taking action. If you experience any unusual symptoms, don't panic. It's important to stay calm and take the necessary steps to address your health concerns. The first step is to see your doctor. Early consultation can make a significant difference in the outcome. They will ask about your medical history and perform a physical exam. This helps them understand your overall health and pinpoint any issues. To confirm a diagnosis, your doctor may recommend imaging tests like X-rays, which can reveal structural changes in your body, CT scans, or MRIs. These advanced imaging techniques provide more detailed views of your internal organs. These tests create detailed pictures of your internal organs, helping to identify any abnormalities. They are crucial in forming an accurate diagnosis. A biopsy, where a small sample of tissue is removed and examined under a microscope, is often necessary to confirm the presence of cancer cells. This procedure provides definitive evidence. Treatment options for carcinoma vary depending on the type, stage, and location of the cancer. Your doctor will discuss the best approach for your specific case. Surgery, radiation therapy, and other methods are available to treat the condition. And chemotherapy are some common approaches. Each treatment has its own benefits and potential side effects. Your doctor will work with you to develop a personalized treatment plan. This plan will be tailored to your needs, ensuring the best possible outcome. Your health matters. Seeking information and support. Facing a carcinoma diagnosis can be overwhelming, but remember, you're not alone. There are resources available to support you every step of the way. Talk to your doctor, ask questions, and gather as much information as you need to feel empowered. Support groups and online communities can also provide valuable insights and connect you with others who understand what you're going through. Remember, knowledge is power. The more you know about carcinoma, the better equipped you'll be to make informed decisions about your health. So take charge of your health today. Ask questions, seek support, and remember, there's always hope. Stay tuned for more informative segments on the Dr. Oz Show.